Bedwetting, also known as enuresis, is a common condition that affects millions of children and even some adults worldwide. Although it's often a source of frustration or embarrassment, it's important to remember that bedwetting is usually a temporary phase and can be managed effectively with the right approach. In today's video, we'll explore the causes, treatments, and practical solutions for bedwetting. What is bedwetting? Bedwetting is involuntary urination during sleep, typically at night. It's most common in children under the age of 7, but it can persist into the teenage years and adulthood for some individuals. Medically, bedwetting is called nocturnal enuresis. There are two types of bedwetting. 1. Primary enuresis. This is when a child has never been consistently dry at night. It's the most common type and usually resolves on its own as the child's bladder matures. 2. Secondary enuresis. This happens when a child or adult starts wetting the bed again after being dry for at least 6 months. This can be due to stress, medical conditions, or changes in the body. Causes of bedwetting. Understanding the causes of bedwetting can help determine the best approach for managing it. While bedwetting is often seen as a behavioral problem, it's important to realize that it's usually due to physiological factors. 1. Bladder development. In many children, the bladder is still developing and may not be large enough to hold urine throughout the night. This is a common reason for primary enuresis. 2. Deep sleep. Some children are very deep sleepers and don't wake up when their bladder is full. Their brain and bladder connection is still developing, making it harder for them to wake up. 3. Genetics. Bedwetting can run in families. If one or both parents had a history of bedwetting, their child is more likely to experience it as well. 4. Hormonal factors. The body produces a hormone called vasopressin, which reduces urine production during the night. In some children, this hormone isn't produced in sufficient quantities, leading to more urine and bedwetting. 5. Medical conditions. Certain medical conditions like urinary tract infections, diabetes, or constipation can lead to bedwetting. If bedwetting starts suddenly after being dry, it's important to rule out these medical issues. 6. Psychological factors. Stress, anxiety, or major life changes, such as moving to a new home or the birth of a sibling, can contribute to bedwetting. For adults, emotional stress can also trigger secondary enuresis. Diagnosis and when to see a doctor. Most children outgrow bedwetting naturally, but when should you consider seeing a doctor? Here are some signs to look out for. If your child is still wetting the bed regularly after age 7. If bedwetting starts suddenly after months or years of being dry, known as secondary enuresis. If your child experiences pain during urination, has unusual thirst or other symptoms that may indicate a medical condition. During a consultation, your doctor may ask about your child's medical history, family history, and any changes in their routine. They may also conduct a physical exam or request urine tests to rule out infections or other underlying issues. While many children eventually outgrow bedwetting, there are treatments that can help manage it in the meantime. Let's look at some of the most effective methods. One of the most successful treatments for bedwetting is behavioral intervention. This includes encourage your child to hold urine for slightly longer periods during the day to increase bladder capacity. This can help the bladder adjust to holding more urine at night. Bedwetting alarms are placed on the child's pajamas or bedding. They sense moisture and sound an alarm when wetness is detected, waking the child so they can go to the bathroom. Over time, this can help train the brain to recognize when the bladder is full during sleep. Positive reinforcement can be helpful. Keep a chart and reward your child with a small prize or praise for dry nights. This encourages a sense of achievement. In some cases, medications may be prescribed, but they are usually reserved for children older than 7 or in situations where other treatments haven't worked. Common medications include desmopressin reduces the amount of urine produced at night. It can be helpful for short-term use, such as during sleepovers or camps, but it's not a cure for bedwetting. Anticholinergics help relax the bladder and increase its capacity. They are sometimes used in combination with other treatments. Making small changes during the day can also reduce bedwetting. Limit fluids in the evening, especially before bedtime, but ensure your child is drinking enough during the day. Encourage regular bathroom breaks, especially before bed. Avoid caffeinated drinks and sugary beverages, which can increase urine production. Managing bedwetting at home requires patience and understanding. Here are some practical tips for parents. Use waterproof mattress protectors to make cleanup easier. Having extra sets of bedding ready can reduce stress during nighttime accidents. It's essential not to punish or shame your child for bedwetting. Remember, it's not something they can control, and making them feel guilty can make the problem worse. Having a consistent bedtime routine that includes using the bathroom right before sleep can help reduce accidents. If your child is old enough, encourage them to help with changing their bedding after an accident. This helps them take responsibility without feeling blamed. While less common, bedwetting can also affect adults. Causes may include urinary tract infections, diabetes, sleep apnea, or even neurological conditions. In adults, bedwetting can also be a side effect of medications or a sign of an overactive bladder. If you're an adult experiencing bedwetting, it's crucial to speak with a healthcare provider to identify the underlying cause and find the right treatment. In many cases, lifestyle changes, medications, or bladder training can help manage the condition. Bedwetting can be frustrating, but with the right support and strategies, it can be managed effectively. Whether it's a child learning bladder control or an adult seeking treatment, understanding the condition and addressing the causes is the first step toward finding a solution. If you're dealing with bedwetting in your family, don't hesitate to seek medical advice and explore the various treatments available. With patience and persistence, dry nights are possible. If you found this video helpful, please like, share, and subscribe for more informative health content. Remember, you're not alone and there's always a solution.